Hello everyone, and welcome to another edition of our web series. As you can see, we have a guest with us today. We wanted to cover a little bit of a different topic today, stay away from the technical aspect, and I've asked Marianne Yazajian to join us today. I'm going to give you a little bit of a background on Marianne. She is a health admin grad from CSUN with her master's, and for the past 6 years she's been managing Glenoaks Imaging. At the same time, she's an insurance specialist. So we've gathered a lot of questions from our patients in the last couple of months when it comes to insurances, authorizations, high deductibles, what patients should do, and the need for a prescription when you need to do a diagnostic test. Welcome, Mary.
Thank you.
Thank you for taking a little time from your busy day.
Oh, my pleasure. I'm glad to be here.
So we'll try to keep this very short and cover as much information as we can. What I wanted to start with is, can you explain which insurances do we accept here at Glenoaks Imaging?
Sure. If I may look at my notes here so I don't blank. We accept all major health insurance plans, PPOs, on our end. We start from some examples: Anthem Blue Cross, Blue Cross Blue Shield, Blue Shield of California, including the covered California plans, United Healthcare, Anthem, Aetna, Cigna, and HealthNet.
It's pretty much all the major PPOs.
All the major PPOs, including the covered California plans. We accept original Medicare from our patients. We work on a lien basis with many attorneys for personal injury cases. Mm-hmm. We accept workers' comps with authorizations from doctors' offices and, again, from attorneys, as long as there is a prior authorization. And we have a really competitive cash price list for many of the diagnostic services that we provide.
Perfect. You can call us to find out about the prices. I can guarantee you we're very competitive with in the market. Before we move on, where are we with the HMOs? What can you tell our patients as far as HMOs are concerned?
Okay, with HMOs right now, we are only in 2 medical groups. We're in a network with Maverick Medical Group and with Primary Care Associates of California. We would like to be in network with more of the medical groups that provide care for patients with
Correct.
HMOs. Unfortunately, their networks are closed for the most part, so it's difficult to get in network with them.
But basically, it's not by lack of trying on our part. We're trying to get accepted with as many HMO plans as possible.
Yes.
Moving on, let's talk about authorizations a little bit. We get many questions. How long does the authorization, take? Should my doctor be the one to start the authorization? Where's our part into obtaining an authorization for the patient? Can you a little bit talk about, let's say the patient gets a prescription for an MRI and they need an authorization. Mm-hmm. They call us. Where do we go from there?
Okay. First and foremost, I want to kind of address how authorizations work. I feel as though patients don't necessarily understand what a prior authorization.
Myself also would like to learn
what a prior authorization means. A lot of the time, patients think that because they have a PPO health plan, they can go wherever, do whatever they need to do. In cases as far as having a health plan that's PPO, you can go to any facility of your choice.
Okay.
However, prior authorization is needed because from the health plan's perspective, prior authorization is used to see if a high-tech imaging scan is deemed medically necessary. So is it necessary for a patient to have an MRI or an expensive CT scan? Have there been other conservative measures or conservative treatments taken prior to having the expensive MRI or CT scan?
I wanted to mention, so the patient shouldn't really look at this in a negative aspect in a way, because they wanted the insurance companies, although money plays a huge role, but also it'll be good to know, do I really need this CT scan that's going to give me so much radiation at this time? Those
Absolutely.
are the things that they like to check to make sure that simpler method, maybe an X-ray or an ultrasound, can answer the questions, before moving on to this high-end tests that cost a lot of money for patients and for insurances alike.
Absolutely. The prior auth is in place for the patient to see if it's medically necessary, and from the facility standpoint. If we were to do an expensive scan like an MRI without a prior authorization, the claim would be denied by the health plan.
The patient will be responsible for it.
In that case, the patient would be responsible for something that costs way more than if they had gone through their insurance. So we're really firm with it. We like to obtain the authorizations on our end. We have a special insurance department in our office. We work with the doctor's offices, usually hand in hand. We try to get all the clinical information that we can so that we can provide it to the health plan to show that, hey, patient ABC needs this scan because they've had...
Something's going on Glenoaks.
Yeah, because they've had, they've already had an x-ray, they've had their ultrasound, and there is no findings, or maybe there is a finding, and now they need a more advanced, detailed scan to see what's happening with them and what's going on.
Makes sense. Mm-hmm. So the best thing would be for imaging center and the doctor's office to collaborate together, obtaining medical notes and all that stuff. And best scenario, sometimes we can get it done the same day, or it might take a few days. How does that authorization?
Some plans we can do online, and it's pretty fast and instant. We can get it within a couple hours. Some health plans require more clinical notes. They want us to fax it into them. They like us to upload it on their websites and their servers before they will give us the authorization. It can take anywhere from 1 to 3 business days, usually is what we tell our patients.
Got it. Moving on to the next thing I wanted to have Marianne kind of talk about is patients with high deductibles. Unfortunately, that's reality, because of how much insurances cost patients just to get into an insurance. They take these plans that have a high deductible.
Yes.
And, I've noticed you guys helping with patients as far as to choose. Maybe, there's some instances that be better for the patient to choose a cash option as opposed to, having a high deductible. They may end up being charged more for that study. So do you guys do that with patients? Do you help? Each case is different?
Each case is different. And I think this is also another really great question that ties into the prior authorizations. Many times patients also don't understand how the deductible works. Yeah. If I can just go back to the prior authorization question and touch base on that, having a prior authorization from the health plan, it means that the service is covered. It means that your insurance company deems that it is medically necessary for you to get the scan. It does not mean that your insurance company will pay for the scan. And I think that's what confuses a lot of patients. They think that, the insurance is going to cover it, everything's going to be paid. And that's not how it works if you have a deductible, especially a high deductible. For example, if you have, I'm going to give a general baseline example. If you have a $1,000 deductible, patient A has $1,000 deductible. In that calendar year, all the medical services that the patient gets, whether it is imaging services, x-rays, MRI, CAT scan, therapies, maybe an injection, whatever the case may be, that first $1,000 comes out of the patient's pocket. It is their responsibility to pay. Thereafter, the insurance will kick in and the insurance will pay a co-insurance. And every health plan is different.
Correct.
Some of them would pay 70%, some would pay 80%. But thereafter, meeting the deductible, the patient is responsible for a co-insurance. And that's just the way that plays out. Usually we like to tell our patients, if they call us, we like to get the information over the phone, go online.
Look up their benefits.
Look up a quick check, look up their benefits, see what their plan is, see if they're close to meeting their deductible, if they're way off base.
Right.
Give them the option of, this is scenario A.
Let them make a decision at that time based on their financial situation.
Exactly. So they can make an informed choice of what they want to do.
Perfect. And last thing I wanted to cover, this subject is very touchy in me. I'll bring up an example. We get a lot of patients calling us saying, hey, I want to come in for an MRI. We asked them, do you have your prescription for the MRI or for the x-ray? They said, no, I'm paying cash for it. Why do I need a prescription for it? Somehow there's a misunderstanding that if you pay for cash, you can have any study. You don't need to go through the insurances or your doctor, but that is not the case.
It is not the case.
For many reasons. For many reasons, why is a prescription absolutely necessary to have a diagnostic test, Marianne?
Okay, so such a good question. A prescription is necessary to have a diagnostic test, especially at our office. We are very picky about this.
Absolutely.
And rightfully so.
Only for patient's interest in mind.
We have the patient's best interest in mind. When a patient comes to us with an order and they need an MRI or an X-ray, that tells us that the patient has already gone to their doctor. They have already been assessed. The doctor has, done whatever conservative measures are needed,
and now the correct exam has been ordered.
And the correct exam has been ordered. That's why the patient is coming to us.
Absolutely.
If a patient comes to us without a prescription, we are not.
Well, it's not our part to assess what study you need. That's
Absolutely.
not our specialty. So,
Absolutely.
So many things can go wrong. You may do the wrong modality, the wrong body part. I may bring an example. You may have leg pain, but the pain may be coming from the back or another third location. So that's why the prescription tells us that you've been seen by a doctor, you've been examined, and the right possible test at that time has been ordered for you. And also, if I can touch another reason why a prescription is necessary, when the doctor writes a prescription, they're kind of responsible for you. They know whatever the results comes back, they'll be able to help you. But if you don't have a prescription, let's just say there's a significant finding, a fracture, a bleed, what do you do then? There's no one that will take care of you. You don't know where it would go. And everybody would be hesitant to take it because it brings up a lot of liability and legal issues. So,
Absolutely.
It's very, very important to have the prescription. It might make business-wise, to have everybody come in and we'll do x-rays and MRIs, but that's not how it works. We're here for the patient's best interest in mind, and we will not perform any studies without a prescription, regardless of what insurance plan you have or whether you're paying cash or not.
Absolutely.
I think that's pretty much all I wanted to cover, not to bore everybody for too long. So we covered what insurances we accept here. We covered how authorization process works and what patients should know. We talked about a little bit about high deductibles and also why a prescription is necessary.
Yes.
If you guys have further questions from this conversation, drop a comment, email, call. Marianne or Nairi is at the insurance department. She'll be able to help. So don't hesitate to give us a call. And thank you, as always, for following us. And we'll see you next month.
Thank you.
Thank you.